Hello, my name is Jeffrey Lowell, and I'm a first-year resident in internal medicine at Northwell Hofstra, Zucker School of Medicine. Here I'll be telling you about intrahepatic cholestasis of pregnancy, or ICP. ICP is a liver disorder that occurs during the second and third trimesters of pregnancy and is characterized by the improper accumulation during pregnancy of bile acids, which are cholesterol-like molecules used for digestion. Buildup of bile acids in the blood leads to their distribution throughout the body and skin, triggering sensations of itchiness, typically in the hands and feet. The combination of itchiness and blood tests showing elevated levels of total bile acids are diagnostic of this disorder, which is confirmed when symptoms and blood bile acid levels resolve in the postpartum period, days to weeks after delivery. However, screening for cholestasis of pregnancy is not necessary in all pregnancies, and testing for increased levels of bile acids is only done when there's a high degree of suspicion for ICP. But why are bile acids increased in cholestasis of pregnancy? The increase in blood levels of bile acids is due to a combination of factors. Foremost are genetic mutations that affect the crucial process of moving bile acids out of the liver and into the bile ducts. Other factors such as hormones like estrogen and progesterone, which are vital to pregnancy and also found in oral contraceptives used for birth control, also reduce excretion of bile acids. Environmental factors are also likely to contribute to the development of ICP, as significant differences in the number of pregnancies with ICP are seen across ethnicities, seasons, and geographic distributions. A combination of these factors reduce the mother's excretion of bile acids during pregnancy, leading to increased levels found in the blood. Normally, bile acids in the developing baby are also removed by transfer from the baby through the placenta and into the mother's blood, but increased levels of bile acids in the mother's blood reverses this flow of bile acids, and they are instead also increased within the developing baby. The risk of health complications related to the baby are increased with higher levels of bile acids found in the mother's blood and include problems such as preterm birth, newborn breathing issues, and possibly even stillbirth. Because the risk of complications increases with levels of bile acids, detecting cholestasis of pregnancy early is important to ensuring a healthy pregnancy and newborn. In managing cholestasis of pregnancy, medications like ursodeoxycholic acid may be able to reduce symptoms, but the only way to completely stop progression is through delivery of the baby. Early delivery, usually at 34 to 36 weeks of gestation, may be recommended depending on symptom severity and a history of other liver conditions. Symptoms of cholestasis of pregnancy will resolve within days to weeks once delivery has occurred. Risks to the newborn are managed through monitoring their well-being while still in the mother's womb and supporting their breathing and other health complications after birth through usual means. One of the notable features of cholestasis of pregnancy is that after delivery, these mothers have been found to be at higher risk of later liver and biliary-related complications including gallstones, bile duct infection, permanent liver damage, and liver or biliary cancer. It is more likely that this increased risk is associated with the underlying contributing factors of cholestasis of pregnancy rather than a direct effect on the liver or bile ducts as a consequence of having developed ICP. There is similarly an increased risk of recurrence of ICP during future pregnancies, but it is important to note that this does not limit the ability to have future pregnancies in any way. Lastly, oral contraceptives that contain the hormones estrogen or progesterone should be used with the caution that there is risk of them increasing levels of bile acids in the blood outside of pregnancy in those that suffered from cholestasis of pregnancy, but complications are rare enough that the benefits typically outweigh the risks of disease recurrence, and it is recommended that oral contraceptives be started or continued in those who wish to use them. And with that, I hope that through this presentation you have a better understanding of the risks, causes, and consequences of intrahepatic cholestasis of pregnancy, and importantly, an increased awareness of the risk these individuals have of later developing other liver and biliary-related diseases later in life. Thank you for your time.